Yesterday there is an article came in the Times of India, Sunday Times, about the abdominal etching. There is a six-pack creation in men, and my opinions also came in that article. And a lot of plastic surgeons, a lot of bariatric surgeons they interviewed. And this article brought a lot of opinions among various plastic surgeons. One plastic surgeon said, I don't advise anybody to go under the knife for a six-pack. I want them to do the regular exercise and diet. That is idea also. See, the people don't want to do diet and exercise. They are not ideal for the six-pack surgery at all. This is for the people who are struggling and doing all the necessary things for the six-pack creation in the gym and the kitchen, and then still they are not getting. Only those people are ideal. Yes, the doctor is correct. If it has to be done ideal way by routine diet and exercise, if you are not getting that, only six-pack is the ideal surgery. Other doctors said it gives an inconsistent results. That's correct. If you select the ideal candidate and do the surgery, it gives a consistent results. If the selection of the patients are wrong, sometimes it gives inconsistent results, and people will be unhappy about the six-pack creation. It looks artificial. So your idea is to not to make them suffer by the surgery. You have to make them understand the procedure and follow the proper exercise and diet to maintain the six-pack. And one bariatric surgeon said that it produces the fat embolism. Okay, fat embolism is not at all a common thing in liposuction, and usually it is common in the big bone fractures where the major blood vessels get opened up, so the big fat particles go inside and gives the pulmonary embolism and fat embolism. That is extremely rare in the liposuction per se, but it might be common in the fat injections in the buttock and few regions. So probably the bariatric surgeon might not be aware of the liposuction techniques. What is the recent advances in the liposuction, because it's not his specialty. It's understandable. So basically we use a blunt cannulas nowadays. So initial generation of the liposuction cannulas are very sharp. That time, yes, major blood vessel injury and major fat embolisms are noted. But now all the cannulas are blunt. Now nobody sells sharper cannulas. So fat embolism is almost nil in the liposuction techniques. And other bariatric surgeons said repeated liposuctions lead on to the fat metabolism disturbances. So true. Definitely none of the plastic surgeons advise repeated liposuction for the same area and on multiple areas also. So fat is the subcutaneous fat between the skin and the muscle has a lot of good functions. So getting rid of it unnecessarily is not a good choice at all. And you have to do the diet and exercise regularly to lose weight. When there is a resistant fat, you do everything, weight has come down, only that few areas, example outer thigh, the love handle, the lower tummy, or the arm, or the like sometimes even calf. So these kind of areas resistant for all kind of diet and exercise, only those areas only addressed with the liposuction. We should not alter the fat metabolism by removing lot of fat in a single person. So is doctor also correct? So everybody has said about their opinions, everybody are correct, and understand this six-pack surgery clearly and approach the doctor if you are ideal candidate. I started this procedure in 2009. Actually that concept introduced to me by a plastic surgeon called Dr. Sasibhushan. He was my consultant. I was trained under him that time. When we went for a round, one orthopedic colleague was seriously trying for the six packs by doing dieting and exercise. We met him on the way and we discussed about the six-pack creation by surgery, and Dr. Sasibhushan told that time, I can create the six-pack for you if you want. I was wondering how plastic surgeon can create a six-pack. I was in the training that time, and then I went ahead and read a lot of articles related to the six-pack creation. Dr. Sasibhushan only created the interest in me about the six-pack creation. So then I read a lot of articles, especially an article by Dr. Henry Mentz. He is a Houston-based plastic surgeon, and he published an article in Plastic and Reconstructive Surgery Journal, that time in about pectoral etching, that is the chest muscle border etching, and the abdominal etching procedure, that is six-pack creation by liposuction techniques. That actually fascinated me. Then I read various other articles related to that. Then I finished my course and I am very much interested in six-pack for a person. And that time one of my active friend came and asked me, I'm trying for a six-pack a lot, would you mind helping me getting the six-pack? So we bought a cannula, 2 suction cannulas, that is 5,000 rupees each, and I used a wall suction and created a six-pack for him. That came out reasonably well. And in fact, we did it under local anesthesia at that time, and he was very much pain tolerant, so we did it under local anesthesia because it's a very much budget case, because he is also upcoming actor. We can't charge him more, and I can't charge him at all because he is my friend. And we did the first six pack for my friend, and it came out really well. And he did a lot of photo shoots afterwards. And then he brought his own friend for the six pack creation. He is also an actor. That time what we did, the power assisted company, they gave a demo of a machine. So because I was planning to buy a machine, so they gave a demo of that machine. So we used the demo machine to create the six pack for that second actor. So it also came out really well. And then our journey started. So I bought the power assisted machine, and I was using all the way till last 2 years, like 2 years back only we bought the ultrasound energy devices. The ultrasound energy devices, why I bought ultrasound energy devices? When I do a six pack creation, when we do a lot of superficial fat removal, without the ultrasound, my energy I use to break that superficial fat and bring it out is very much. So when I use that lot of energy, a lot of bruising, a lot of redness will be there, a lot of pain will be there. So patients, the discomfort and the recovery will be a little slower. So when I use the ultrasound energy, what ultrasound does, it makes that fat disintegrate and become loose in that area. So when I do a power assisted afterwards, it easily comes out. So I do not use a lot of energy to remove that fat. So the bruising will be less, the pain will be less. So it's advantageous. When I finish doing these 2 six-pack creations, I have a feeling that I have to refine my skills. So for that reason, I visited US and I visited multiple centers across US in 2010. I visited Dr. Henry Menz, who was a pioneer in creating the six-pack creation and the pectoral muscle etching, the chest muscle etching. These 2 procedures are popularized by him after he published the paper in Plastic and Reconstructive Surgery Journal way back. So I visited his center in Houston in Texas, and he's a very, very nice person. He's kind enough to teach me a lot of the fine techniques to get the six packs more, and what are the post-operative advices you give for the patients, and a lot of things I learned from Henry Menz. In fact, one of my junior guy who visited Dr. Henry Menz recently, but he remembered my name until Dr. Karthik visited 10 years back, kind of. So I'm very much happy that I was one of the person who visited his center and learned his techniques. And after that, the journey continues. So this is my six-pack journey from 2009 to 2023. How we create the six-pack and who are the ideal patient for the six-pack creation. The six-pack is the midline tummy muscle. The midline tummy muscles have a lot of skin attachments. Between each muscle bulk, some skin attachments comes from the muscle and attached to the skin. When the muscle become bulkier, the skin attachments become more evident. And basically, when muscle become bulkier and the fat in that region also has to come down in size. Both the things together, the pack become more evident. And then why to go for the surgery? So some people, they do a lot. They do the proper dieting and exercise. They do all kind of exercises to get the six pack, but still they won't get it. Those are all the ideal people for the six pack. It is not that I am obese, I don't want to do exercise, I don't want to do diet. They are not ideal at all for the six pack creation. So what we do in six pack creation, now we do the ultrasound assisted device to disintegrate the fat. So in that area where the lines supposed to come. See, same way when you are creating the midline and the side lines and the in-between lines, you should not make it a thin line. It should be a thicker, at least 1.5 centimeter in thickness. Then only that when you have to give allowance to the skins to go and attach nicely. So you have to make that line thicker. When you are drawing the six pack, normally what we do is we make them crunch and do the marking for the six pack. And we remove superficial as well as the deep fat completely. We remove in that region. And as well as if they have a little more extra fat in the mid tummy or lower tummy, some people they have the resistant fat in the mid tummy, lower tummy, sometimes in the love handle. We remove those fat also. Superficial fat and deep fat in the areas where we want to create the line. So this is called the six pack creation. But same way, a lot of young plastic surgeons, you should not create the six pack in a symmetrical way. If you properly examine the tummy when they are crunching, usually, say example, this right side the line is in one level, left side line will be a few millimeters down or few millimeters up. So try to create a natural looking six pack. Even like after some time they are not, they left every exercise diet, they gain weight, your six pack should not look odd. So create a natural looking six pack. So make sure that you are marking the lines exactly line where they have the six packs. Okay, these are all the things you need to be clearly aware of before creating a six pack surgery. So same way, when you are obese and lot of you have the intra-abdominal or visceral fat, your tummy is already bulgy like this. Creating a six pack over that area, it looks very artificial. So you definitely are not ideal for six pack creation. And same way, when you have a lot of subcutaneous fat, creating the six pack is definitely not ideal thing. Lose weight and bulk up your muscle and make the muscle more toned, then come for the six pack creation, it will be easier. And it's ideal also. So the six pack creation is not for obese people, not for people who think that it's a shortcut for diet and exercise, and it's ideal for only people who lose weight and they diet and exercise but still they are not getting the six pack. They are the only people ideal for six pack creation. Same way, after the six pack creation, when they are not doing any exercise and diet, they leave everything, even the small fat particles in their line get bulged up, so the pack will disappear. But only one good news is, after some time they want to get the six pack again, hitting the gym and doing a regular workout, bring back the six pack faster. So that is the only advantage of going for the six pack surgery, and people who deserves it and definitely who understand this fact are ideal candidate for the six pack surgery.